Welcome to today's video about symptoms of low testosterone in men. Have you ever felt like something is off with your body, but you can't quite identify it? You're constantly tired, your motivation has vanished, and unexplained changes are occurring. The culprit might be hiding in plain sight within your hormonal system. Low testosterone affects millions of men worldwide, and while most know about obvious signs, there are strange symptoms that medical science is now revealing. These hidden indicators could be transforming your life right now without you realizing it. In the next several minutes, you'll discover 13 unusual symptoms backed by scientific research that could point to low testosterone levels. Some of these will genuinely surprise you, and by the end, you'll understand why recognizing them early matters for your health and quality of life. This isn't just about masculinity or aging. It's about understanding your body's signals and taking action when something isn't right. Let's explore these connections between testosterone and your overall well-being. All right, let's dive into the signs of low testosterone in men, starting with number 1. Persistent brain fog and memory problems. Imagine walking into a room and forgetting why you're there, struggling to find words during conversations, or feeling like you're thinking through thick fog. This isn't just forgetfulness. Research has established a strong connection between testosterone and cognitive function in men. Your brain contains testosterone receptors, particularly in the hippocampus, the memory center responsible for learning and recall. When testosterone drops, these receptors can't function properly, leading to cognitive impairment. Men with low testosterone frequently report difficulty concentrating, word recall problems, memory lapses, and mental cloudiness. Studies show men with cognitive issues often have lower testosterone than those without. What makes this symptom strange is how gradually it develops. You might blame work stress, poor sleep, or aging, never suspecting hormones are the actual cause. The impact extends beyond inconvenience, affecting work performance, relationships, and daily decision-making. This cognitive decline isn't inevitable aging. It's a treatable hormonal imbalance deserving medical attention. Next, symptom 2. Increased sensitivity to cold temperatures. Do you reach for sweaters when everyone else seems comfortable? Feeling constantly cold is a peculiar symptom of low testosterone, rarely connected to hormone imbalance. Research demonstrates testosterone plays a crucial role in thermoregulation and metabolic heat production. When testosterone declines, your body's temperature regulation becomes compromised. This happens because testosterone affects metabolic rate, muscle mass distribution, and temperature-regulating neurons in the brain. Men with low testosterone often report feeling cold in comfortable environments, persistently cold hands and feet, or needing extra clothing layers throughout the day. The mechanism involves testosterone's role in maintaining lean muscle mass, which generates body heat through metabolism. Lower muscle mass means reduced heat production and increased cold sensitivity. Additionally, testosterone influences neurons in the brain's preoptic area, regulating temperature responses. What makes this strange is its seemingly unrelated nature to reproductive hormones, yet it's consistent in men with documented testosterone deficiency. This temperature dysregulation significantly impacts daily comfort and quality of life. Next, symptom 3. Unexplained decrease in body hair growth. Beyond scalp hair loss, many men with low testosterone notice their beard grows slowly, body hair becomes sparse, or they shave less frequently. While seemingly convenient, it's actually a visible sign of hormonal imbalance. Testosterone directly regulates body and facial hair growth patterns, influencing both density and growth rate of hair follicles. Research indicates testosterone affects the hair growth cycle, specifically the anagen or active growth phase duration. When testosterone declines, hair follicles spend less time growing and more time resting. Men experiencing this notice they shave less often. Their beard appears patchy or uneven. Chest hair thins or arm and leg hair stops growing. What makes this strange is it contradicts common perceptions about testosterone and hair. While scalp hair loss associates with testosterone metabolites like DHT, body and facial hair actually require testosterone for growth, creating an apparent paradox. The change develops gradually over months or years, making it easy to overlook. This visible change in hair patterns serves as an external marker of internal hormonal shifts, deserving medical evaluation. Next, symptom 4. Gynecomastia, or male breast tissue, development. Few things are as distressing as developing breast tissue, yet this can occur when testosterone levels fall significantly. Gynecomastia, the medical term for male breast enlargement, results from hormonal imbalance between testosterone and estrogen. The balance between these hormones is crucial for male physiology. When testosterone drops, estrogen's effects become relatively more pronounced. In men, small amounts of testosterone convert to estrogen through an enzyme called aromatase. When testosterone levels are low, this process can lead to relative estrogen dominance, stimulating breast tissue growth. Men experiencing this notice tenderness, swelling, or actual glandular breast tissue development in one or both breasts. Research indicates gynecomastia affects many men with testosterone deficiency. What makes this particularly concerning is its visibility and impact on self-image. The breast tissue that develops isn't just fat, it's actual glandular tissue responding to altered hormones. Studies show this condition can be managed or reversed with appropriate treatment when addressed early. The psychological impact is significant, as this visible change affects masculine identity and can lead to social withdrawal. Next, symptom 5. Chronic sleep disturbances and insomnia. Sleep problems represent one of the most underestimated symptoms of low testosterone, creating a destructive cycle that further depletes hormone levels. Research reveals a bidirectional relationship between testosterone and sleep quality. Low testosterone disrupts normal sleep architecture, particularly affecting deep sleep stages essential for hormone production and physical restoration. Men with testosterone deficiency often experience difficulty falling asleep, frequent nighttime awakenings, early morning waking with inability to return to sleep, or generally, poor sleep quality. What makes this strange is its self-perpetuating nature. Poor sleep further suppresses testosterone production, which occurs primarily during deep sleep, creating a downward spiral. Scientific studies document that men with low testosterone show altered sleep patterns and reduced deep sleep. The mechanism involves testosterone's influence on sleep-regulating neurotransmitters and breathing patterns. Men with low testosterone also have higher rates of sleep apnea, which independently affects both sleep quality and testosterone production. This sleep disruption leads to daytime fatigue, irritability, and cognitive impairment, compounding other testosterone deficiency symptoms. Many men treat insomnia with sleep medications without addressing the underlying hormonal cause. Next, symptom 6. Profound loss of motivation and drive. Waking up feeling like there's no point in pursuing goals, watching projects sit unfinished, and experiencing complete lack of ambition represents one of testosterone's most psychologically devastating effects. Research has established testosterone plays a crucial role in the brain's reward and motivation circuits, particularly affecting dopamine pathways driving goal-directed behavior. When testosterone declines, The neurochemical balance supporting motivation becomes disrupted. Men with low testosterone describe feeling apathetic, lacking competitive edge, and experiencing diminished interest in activities that previously brought satisfaction. This goes beyond typical depression, though the two can coexist. It's a specific dulling of ambition that feels fundamentally different from mood disorders. What makes this insidious is its gradual onset. Projects gradually lose appeal, career advancement seems unimportant, and the internal fire slowly dims without obvious cause. Studies using brain imaging show testosterone influences activity in regions associated with reward processing and decision-making. Men often blame external circumstances like work pressure or life changes, never realizing hormones are undermining their psychological drive. This motivational deficit significantly impacts career success, relationships, and overall life satisfaction. Next, symptom 1-7, unexplained muscle loss. Despite exercise, you're training regularly, maintaining protein intake, yet somehow your muscles are shrinking rather than growing. This frustrating paradox is one of low testosterone's most visible physical manifestations. Testosterone is fundamentally anabolic, meaning it promotes muscle protein synthesis and prevents muscle breakdown. Research demonstrates that when testosterone declines, this balance shifts toward catabolism or muscle loss, regardless of training efforts. Men with low testosterone notice muscles feel softer, strength gains plateau or reverse, recovery from workouts takes longer, and overall muscle mass decreases despite consistent training. What makes this particularly frustrating is that it persists despite proper diet and exercise. The mechanism involves testosterone's direct action on muscle satellite cells, essential for muscle repair and growth after training. Without adequate testosterone, these cells cannot effectively respond to exercise stimulus. Scientific studies document that men with low testosterone show significantly reduced muscle mass and strength compared to age-matched individuals with normal levels. This muscle loss affects functional strength, metabolic health, bone density, and independence. The discouragement of working hard without results can lead to training abandonment, creating further health decline. Next, symptom 8, increased abdominal fat accumulation, that stubborn belly fat refusing to budge despite diet and exercise, might signal something about your testosterone levels. Research has established that low testosterone and abdominal obesity exist in a bidirectional relationship, each worsening the other. Testosterone influences how and where your body stores fat. When levels drop, fat preferentially accumulates around the midsection in a pattern that increases health risks. This visceral fat surrounding your organs is metabolically active and produces enzymes that convert testosterone to estrogen, further lowering available testosterone. Men with low testosterone notice waistline expansion, even when overall weight remains stable, clothes fitting differently around the middle, and loss of more angular masculine body composition. What makes this particularly challenging is its resistance to traditional weight loss methods. You might reduce calories and increase cardio, yet struggle with midsection fat because the underlying hormonal imbalance sabotages efforts. Studies show that abdominal adipose tissue contains high levels of aromatase enzyme, which converts testosterone to estrogen, creating a hormonal environment promoting further fat storage. This self-perpetuating cycle makes weight management increasingly difficult and increases risks for cardiovascular disease, diabetes, and chronic conditions. Next, symptom 9, decreased bone density and fragility. Most people associate bone health with women, making testosterone's role in male bone density one of its most overlooked functions. Research conclusively demonstrates testosterone is critical for maintaining bone mineral density in men throughout their lives. When testosterone declines, bones gradually become weaker and more porous, significantly increasing fracture risk. Men with low testosterone may experience unexplained bone pain, stress fractures from minimal trauma, height loss from vertebral compression, or diagnosed osteoporosis. What makes this particularly dangerous is its silence. Unlike muscle loss, you can see, bone loss occurs invisibly over years without symptoms until a fracture occurs. The mechanism involves testosterone's direct effects on osteoblasts, cells responsible for building new bone, and its conversion to estrogen within bone tissue, which prevents excessive bone breakdown. Studies show men with testosterone deficiency have significantly lower bone mineral density in the spine, hip, and other weight-bearing bones. Men with low testosterone have substantially higher risk of osteoporotic fractures, which can be devastating for independence and quality of life. Early recognition and treatment are crucial because bone loss is easier to prevent than reverse. Next symptom: reduced red blood cell production. Feeling constantly exhausted and short of breath during normal activities might signal more than poor fitness. It could indicate testosterone-related anemia. Research has established that testosterone stimulates red blood cell production in bone marrow through multiple mechanisms. When testosterone falls, red blood cell production decreases, potentially leading to anemia. Men with this experience persistent fatigue unrelieved by rest, shortness of breath during minimal exertion, pale skin, rapid heartbeat, and difficulty concentrating due to reduced oxygen delivery to tissues. What makes this challenging is that it mimics many other conditions, from iron deficiency to chronic disease, leading to misdiagnosis if testosterone levels aren't evaluated. The mechanism involves testosterone's stimulatory effect on kidney production of erythropoietin, a hormone signaling bone marrow to produce red blood cells, plus direct effects on bone marrow stem cells. Scientific studies show men with low testosterone have significantly lower hemoglobin and hematocrit levels compared to those with normal testosterone. This explains why some men feel dramatically more energetic after starting testosterone therapy as their red blood cell counts normalize. The fatigue from testosterone deficiency anemia is profound, affecting work capacity, exercise tolerance, and overall vitality. Next symptom: 11. Mood changes, including depression and irritability. The sudden shift from your usual temperament to persistent sadness or unexplained irritability might be testosterone speaking through your emotions. Research has documented strong associations between low testosterone and mood disorders, including depression, anxiety, and irritability. Testosterone influences neurotransmitter systems in the brain, particularly serotonin and dopamine, which regulate mood and emotional well-being. Men with low testosterone often describe feeling more emotional than usual, experiencing tearfulness over minor issues, having shorter tempers, or developing persistent low mood that doesn't respond well to standard treatments. What makes this notable is its inconsistency with typical personality and resistance to psychological interventions alone. The biological mechanism involves testosterone's effects on brain regions responsible for emotional regulation, including the amygdala and prefrontal cortex. Research using brain imaging has revealed altered activity patterns in these regions in men with low testosterone. Additionally, mood changes associated with testosterone deficiency feel qualitatively different from primary depression, often described as emotional flatness or numbness rather than deep sadness. Men report feeling unlike themselves, disconnected from emotions, or experiencing anger disproportionate to situations. This emotional instability can damage relationships significantly. Next, symptom 12, testicular atrophy or shrinkage. Perhaps the most direct physical manifestation of certain types of low testosterone is shrinkage of the testicles, the very organs responsible for producing most of your testosterone. Research has documented that chronic low testosterone, particularly when caused by pituitary dysfunction or other central causes, can lead to decreased testicular volume. The testicles contain specialized Leydig cells that produce testosterone in response to hormonal signals from the pituitary gland. When this signaling system fails or becomes suppressed, the testicles can atrophy from lack of stimulation. Men with this condition notice their testicles feeling smaller or softer than usual, experiencing discomfort, or observing visible size reduction over time. What makes this concerning is its direct visibility and the anxiety it creates. Unlike internal hormonal changes, testicular shrinkage is observable and often deeply distressing. The mechanism involves loss of cellular volume in testosterone-producing cells and the seminiferous tubules where sperm are produced. Studies show testicular volume correlates with testosterone production capacity and sperm count. This symptom often accompanies other signs of testosterone deficiency and warrants immediate medical evaluation. Early detection and treatment can sometimes reverse atrophy. Next, symptom 13, reduced libido and sexual function. Changes, perhaps the most well-known symptom is the dramatic decrease in sexual desire and function that accompanies low testosterone. Testosterone is the primary hormone responsible for male libido and sexual function. Research consistently demonstrates testosterone levels directly correlate with sexual desire, arousal, and performance. Men with low testosterone experience decreased interest in sex, difficulty achieving or maintaining erections, reduced spontaneous erections, fewer sexual thoughts, and decreased satisfaction from sexual activity. What makes this significant is that it's often the first symptom men notice and report to healthcare providers. The mechanism involves testosterone's effects on multiple aspects of sexual function, from stimulating neural pathways associated with desire to promoting blood flow necessary for erections. Studies show testosterone influences nitric oxide production in penile tissue, essential for erectile function. Men with testosterone deficiency often notice gradual changes in sexual interest rather than sudden loss, making it easy to attribute to stress, relationship issues, or aging. However, when sexual function declines significantly and persistently, testosterone evaluation is warranted. This symptom profoundly affects relationships, self-esteem, and quality of life. Fortunately, when low testosterone is the cause, appropriate treatment can restore function. These 13 symptoms reveal how extensively testosterone influences your body and mind. From cognitive function to bone health, from temperature regulation to emotional stability, testosterone orchestrates countless processes defining male vitality. Recognizing these symptoms is critical because low testosterone is treatable when properly diagnosed. Many men suffer for years, attributing symptoms to stress or aging, never realizing simple blood testing could reveal the cause. If you've recognized several symptoms, speak with a healthcare provider about comprehensive hormone testing. Normal testosterone levels vary, but symptomatic deficiency deserves medical attention. Early intervention can prevent progression and potentially reverse many effects, restoring quality of life and energy. Remember that testosterone naturally declines with age, but symptomatic deficiency isn't inevitable. If you found this information valuable and helpful in understanding what might be happening in your body, please type "valuable" in the comments. Your engagement motivates us to create more evidence-based content. Like this video, share it with others who might benefit, and subscribe for more health insights. Thank you for watching.